We're at an important part of the program here because this is a little bit of a transition that we're going to go through. We had a great day yesterday talking about progress and updates. This morning we had a lot of science, and right now this is a panel that's going to transition us through the science into the rest of the afternoon, which is about communication, especially to consumers. So what we're going to do here, I'm going to introduce these folks in a minute, but we're going to really encourage some discussion among the panel and with you. So on your tables, you have these cards. If there are none left, just hold up your hand, and there's a big stack of them over there. They'll bring them to you. But if you could just make out any questions that you have for the panel as we go along, when you're finished, just hold up your cards and somebody will pick those up. If you don't want to have a microphone, otherwise we will open up the microphone a little bit later in the presentation. But I'm going to introduce these folks, and then some of them do have comments to make, but we also have some issues around this question of data needs. What information would be most helpful to the various groups and sectors? We're going to talk about that specifically and ask the panel to discuss it with each other. But let me introduce these folks, and I am, as some of the other moderators, I'm just going to give you their names and affiliation because you do have these books, and this is such an extraordinary panel with such a diverse array of experience and expertise that it's going to be a lot quicker for you to read their very distinguished backgrounds than it will be for me to read it to you. But starting on my left, Shannon Wharton, who you had the pleasure of meeting yesterday. She is the research manager for High Plains Feedyard and oversees their education and research center. Dr. Bob Smith, who heads up the veterinary research and consulting services. Dr. Peter Davies, veterinary epidemiologist, department chair and professor at the University of Minnesota. Lori Marco, who is the senior vice president for external affairs and the general counsel for Hormel Foods Corporation. Mike Brown, who is the director of the dairy supply chain for the Kroger company. And Dawn Sievert, who you met a little earlier this morning. She is the Associate Division Director for Antimicrobial Resistance in the Division of Foodborne, Waterborne, and Environmental Diseases. So some of our panel are going to make some brief opening statements. And can we start with Dawn, and we'll work our way back?
You want to start with me first?
If you don't mind. Is that okay, Stuart? Thank you.
And I don't have any slides. So. Okay. Thanks, Steve. So I just have some thoughts and wanted to walk through a couple of bullet points to sort of set the stage for what we're responsible for at the CDC and the work and the space that we fit in the division that I work in, food, water, and environmental. Basically, like Steve said, to prompt some thought and open discussion on collaborating and how we can work together. So basic first fact, and I'm not going to use slides. CDC's mission is to protect the health of people. And as you heard from Dr. Hicks this morning, there's a lot of work going on at the CDC working to address antimicrobial resistance around healthcare settings through management of the infections, antibiotic stewardship, outbreak response, and innovative research. But we know and acknowledge antibiotic resistance is a One Health issue, and that is the space that CDC wants to work in to address this issue. So in addition to leading the efforts in the healthcare-associated work that Dr. Hicks spoke of this morning, in the division that I'm working in, we also focus on preventing and controlling disease, disability, and death caused by foodborne, waterborne, or environmental transmitted infections. So to track the emergence of these resistant infections, we have multiple surveillance systems, which I'm not going to go into and describe, which is to say there's multiple ways that we do get data within our division to look at these human illnesses. So the data that are reported for enteric illness and the isolate submissions from the pathogens, and again, we're talking about Salmonella, Shigella, Campylobacter, E. coli, Listeria, help the division identify and respond appropriately to outbreaks and unique cases of antimicrobial resistant illnesses. And also we use these data to track these trends of resistance. And you heard Dr. Tate talk a little bit about the NARMS data, and we are also a part of that with FDA and USDA. So from the human specimens and the epidemiologic data, we can ascertain the causal pathogen. We can look at the phenotypic and the genotypic resistance information, so that's through PFGE patterns, through whole genome sequencing, and we also know the risk factors that are associated with the human illness, so the who, what, where, when, and how. We have to remember that resistance, again, always we remind ourselves that we address this within the One Health paradigm. And because we know that when we are working on any of these illnesses, we're always looking at the interconnections. And with our work, we never work within a single space. We are always overlapping, again, because of our work within the division with either foodborne or animal contact or environmental contact and issues. And so we need the resistance and use data to connect with that from the human side to the animal and the environmental side to be able to identify where there might be additional areas for improvement, things that can be implemented, potential sources that could be improved or remedied. Again, our goal is always to be able to give the affected population of people the best prevention messages to empower them to be able to keep themselves healthy and safe. We rely clearly through all of this on our federal partners as well as state and local partners in health and agriculture and our industry partners for a lot of this important information and the collaborations to be able to help us do our work as well. So these efforts are vital to identify, respond, and control. And we rely on these relationships and collaborations to be able to connect the dots, to be able to, again, develop appropriate and preventive measures. Our current collaborative efforts right now are mostly, we feel, reactive. And what we would like to do is be able to become proactive in our efforts. So instead of working within this space in an emergency situation where there is a new resistance identified or an outbreak or a cluster of illness that we have to immediately respond to and put together information, we would like to move into the space of getting ahead of things and being able to open up relationships and collaborations so that we aren't always just responding to emergency, but we have strong relationships where we can help identify where is the resistance, where is the use, and across these ideas, sort of the scatter plot of where there are drivers of resistance, where can we all work together to improve? How can we help at the CDC to do that? Sometimes it will be something that we have to act on and react to, information we put out, but it might also just be information we can provide for others then in their space to work on, whether it's industry or some of our other federal partners in the space that fits. In addition, we heard EPA being brought up as well for environmental and things like that. So sometimes it's our work and sometimes all we can do is provide information on what we found out and then pass it along to others who will actually work on that. So I think in all of that it's to recognize that there are no perfect data. And I think that's come up multiple times already. There's always a trade-off and a balance required between the details that we need for comprehensive data or the burden of collecting it. But it doesn't let us off the hook. So I think it means that important decisions need to be made, and different data are going to be helpful for different scenarios and for different purposes. So I'll just end by saying I look forward to working with all of you through our collaborations to determine which data are necessary and feasible to attain our mutual goal of controlling antimicrobial resistance for the health of all populations. Thanks.
Well, this is going to be a little simpler, because I have a degree in cow milking. I'm not a scientist per se, but I work for Kroger. Kroger is actually the second largest employer in the United States. We have 440,000 employees and 2,900 stores and many convenience stores across the country. We are what you would call the traditional food service grocery. By the way, in this market here is Teeter is our Kroger company. We're a full-service grocery, which means we try to meet all consumer needs. We have value customers looking for quality at a good price. We also have our natural food customer, which is our fastest-growing part of our business. And we're seeing a lot of growth. Again, no big surprise here in the prepared food business. It's a very competitive industry. It's been a particularly tough year for, I think, all supermarkets, and Kroger's been no exception. when we think of regulation and when we think about how conversations like we're having today can best help us meet our consumer need and best help us meet make sure that we're not that we're helping our consumer get a safe, reliable, quality supply of food, and we're not inadvertently through production practices creating issues with antibiotic resistance. We really rely a lot on government regulatory agencies. I think a very good example is a lot of the things that are coming out of the Food Safety Modernization Act right now. The FSMA is changing the way our relationships with our suppliers. By the way, Kroger has 38 plants. We have 21 dairy plants. We produce everything from milk, ice cream, yogurts. We also do a lot of cheese cut and wrap, we would call it, packaging of cheese. It's about, on a raw product basis, about $1.5 billion business. It's a very big business. There's 5 of us that run that procurement side of our business. We really see our challenges is how we corral all this wonderful information that we're all collecting, and it's obviously a very collaborative effort, in a way that we can explain it cleanly and simply to consumers, and at the same time avoid people picking a piece of it, running with it through blogs or other things, and just scaring everyone to death. I guess where I'm seeing it right now, which is antibiotic resistance, is some of the fervor on GMOs, which I personally find extremely frustrating because basically we're going to make food more expensive. I'm not sure lowering crop yields by 15% is a good solution to world hunger. So how do we do that? How do we work with this brilliant room of people from the standpoint of retailers or anybody else in the food chain to keep the message clean as possible and do the best? I had a brief conversation before this talking about organics. We obviously sell a lot of organic products. I think there's certainly lots of questions if there's really any health benefit to organics. I personally think the research says there really isn't. And don't quote me, please. I don't want to get in trouble with my customers because we buy organic milk too. But the fact that it is a USDA program with a set of rules, people have comfort versus a health claim. You know, I remember when I was a kid reading Mad Magazine in an article on it was a whole issue on advertising. It says how you can make things sound bad or good depending how you put it. And it was, buy our cookies. No one's ever died from eating our brand. Well, maybe no one's ever died from eating the other brands either, but that message is so important. And I think our biggest challenge is all the great research and work that's going on, and particularly when we're dealing a lot of it with empirical. For example, we talk about incidents of antibiotic breakouts, resistance. It's tough to build a mesh, a regulatory mesh, or even a process mesh that is explainable to the consumer at the same time workable by our friends in agriculture, the producer products that we use. So I look forward to the rest of the conversation because this afternoon for me is working for a retailer is going to be very, very interesting.
Thank you, Mike. Lori?
Hi. So just a short introduction to Hormel Foods Corporation. We're a branded protein company servicing both retail and our friends at Kroger and food service outlets. We have a full line of traditional proteins, black label bacon, Spam. Yesterday, you may have seen, we announced our acquisition of Columbus Meats. This acquisition enhances our premium deli portfolio. And we also own Genio Turkey Store, one of the largest turkey processors in the country. We have a full line of non-meat proteins, muscle milk protein supplements, beverages, and powders. Muscle Milk recently introduced their new Evolve brand, which is a pea protein version of those same products. We also own Skippy Peanut Butter and Justin's Nut Butters. We have a full line of Mexican sauces, dips, and dinners, including Holy Guacamole and Chi-Chi's Salsa. So we're really in the center of the resistance conversation with our protein products. We're vertically integrated to some degree in both turkey, much more in turkey than in swine, but vertically integrated in both. And we also work very closely with our farmer partners. We also face the consumer with our branded products, and we are keenly aware of the medical situation, the interests of our consumers and customers, and also the realities of food animal production. So in preparation for this conversation about data, I looked up the definitions. Data is a set of individual facts, statistics, or items of information. Statistics is the science that deals with the collection, classification, analysis, and interpretation of numerical facts or data. and that by the use of mathematical theories of probability imposes order and regularity on aggregates of more or less disparate elements. So is it data, or is it the science of combining that data so that we can all make sense of it? So there's a lot of data out there, and some companies and institutions report out data, but data needs to be relevant and relatable. Without imposing order on that data, we cannot measure success. We can't even define success. We need to be able to establish baselines and make comparisons across species, disease conditions, medications, and circumstances. We need to determine what success looks like and how to measure ourselves against that. Without context and a basis for comparison, data is worthless. Right now at Hormel, the data we can understand is consumer data and demand data. Consumers do indeed report an increasing interest in the use of antibiotics in food livestock. And data would indicate that demand for protein from animals is raised without antibiotics is rising. So we're paying attention to the issue, both to meet consumer demand and because we believe antibiotic stewardship is the right thing to do. But what we need to do is work with both our independent producers and our customers and consumers to really understand what antibiotic stewardship means in this context and in the realities of large-scale animal production. The solutions are not simple, so as to lend themselves to being tweeted out, but consumers and producers both deserve to understand the realities of resistance and their part in combating resistance. There are many researchers and veterinarians right now working to find a way to put those statistics into context, and we happily support that effort so we can speak to our producers and consumers with clarity and transparency.
Thank you, Laurie. Do you want to make a comment, Peter?
Sure. Yeah, Peter Davies, I've been around this issue probably 20, 25 years. My background is a veterinary epidemiologist, primarily working with swine, and I've done quite a lot of work on zoonotic and foodborne diseases in swine, and have become more involved with the measurement of antibiotic use over the last couple of years through work done with the National Pork Board, and currently I'm a collaborative agreement, like Nora was with the FDA, working with Dr. Randy Singer in collecting data on antibiotic use, Randy looking at the avian industries, and myself working with the swine industry. So I feel on this issue wise like one of the blind men who's hanging on to a piece of the elephant, so I'm going to tell you a little bit about my piece of the elephant and how I see these things, and perhaps make some contrasting comments to some that I went before. To me, the most important thing in this discussion to give direction to collecting data is definition of purpose. We've had these discussions. I think Nora did a really good job earlier just showing you how differently things could look from the same antibiotic use in a production situation depending on how you choose to do the math. So some of the purposes we can have, and I'll use my example in obtaining antibiotic use data in food animals, is simply to measure. We just want to understand the what and how big it is. We may want to actually understand the what and educate and move in the stewardship direction. So my own bias is that if we really want to have a long-term goal of promoting more judicious, effective antibiotic use so that we're maximising animal health and welfare benefits while minimising associated human health risks, we really need to understand both those pieces of the picture with respect to efficacy of drugs, what actually constitutes appropriate use, and also the much more difficult area, perhaps they're both difficult, of how our activities in the farm and production environment actually do translate to human health risks. I spend my time in talking with veterinary producer audience. I say, we don't know what the impact is, but I'm sure it's not zero. And because it's not zero, we have an ethical obligation to make sure we get better at what we're doing, and therefore we need to look at our practices. The comment Laurie made about the need to compare across species, this is where I'll perhaps contrast with it, because I think to get the most meaningful data, and then again, this is my bias of a person who's affiliated with one species, is that the comparisons between countries, people want to compare what's happening in Europe and what's happening here or somewhere else. They want to compare poultry, or they want to compare swine or cattle. The example I've started using is, and just a geographic one, is saying, well, in Uganda, they use much, much more antimalarials than they do in Finland. And of course, that's a completely ridiculous comparison because there's no malaria in Finland. But if we're saying, well, should the Ugandans be like the Finns and stop using it? What's going on? Because what's missing is the context of the medical reality and the disease risk in that context. So I won't go on much longer, because another example, I think, in terms of comparing among species is saying, and we've seen today the progress that's been made in antibiotic-free production in the poultry industry. And I've had people say to me, well, why aren't you doing that in pigs? And my response now is if you can give me a pig that hatches out of an egg, doesn't have to suckle its mother, doesn't have to be weaned, and only has to live for 40 days, I can probably make a lot of progress. The reality is the biology of these different animal species are very different. Their lifestyles are different. Their products are different. The interface with the consumers are different. And so I guess and though I can understand from a food industry and the need to be able to get some benchmarking going, my own position is I'd advocate at least that if we want to address the core issue of getting better antibiotic use in food animal productions, our data needs in that area have to be focused on how antibiotics are used, the efficacy of those antibiotics primarily, because the issue of what's appropriate and what's inappropriate is in itself a complex discussion. I think Nora was about to show us a slide saying use can be necessary or unnecessary, and what I think everyone agrees is that use of antibiotics without associated clinical benefits to animals is the ultimate in inappropriate use. So I think in some of the discussions from Mark Pappage and Dave Smith, this need to really understand what our clinical practices mean in terms of efficacy and in terms of resistance is a really crucial research goal. And I just want to say I really appreciate in Joel Neerham's and the other presentations, I think the recognition that a lot of the industries are taking a way more progressive stance on this issue and trying to move forward, which is fun to be a part of. Thank you.
Thank you, Dr. Davies. I appreciate your comments that you made about putting things in context, because I think too often we are guilty of trying to put us all in the same bucket where we expect this from poultry and swine and dairy and beef. And each of those management systems are different. And I come from the beef side. And incidentally, beef people generally don't go to cocktail parties. And so for the beef people, there'll be an old pickup truck out back with a few six-packs of Keystone. We'll sit on the tailgate and visit for a while. So that's our culture. But the beef industry is certainly not integrated. We have over 700,000 people in the United States that own at least one cow. And when we divide that out into the number of cows, that means that there's slightly over 40 cows per herd. That's the average. We know that there are very large ranches that have thousands of cows, but there are a lot of people that have fewer than that average also. So our marketing system in itself creates challenges for us in that we gather cattle from all over the United States. The ruminant is capable of converting forage from land that is not suitable for cultivation because of lack of rainfall, erosion hazards, the topsoil is too thin, and producing beef from that. So I think it's a great opportunity and a blessing that we can produce beef under those circumstances, but at the same time, we're losing almost 1 million acres of farmland per year. That's been pretty consistent over the last 8 or 10 years, losing that to development. So as part of that beef production process, we will gather these calves from all over the United States and move them to areas where grain production is abundant, and we have weather that is suitable for feeding cattle. And along the way, they'll stop somewhere in Oklahoma or Texas and other locations. They'll graze wheat pasture or they'll graze summer grasses. And that, too, is the opportunity to utilize forage rather than cereal grains for production. So on a life cycle basis, the cattle are going to get 80 to 85% of their nutrient base from forages on a life cycle basis. So through this process of marketing and transportation and perhaps changing ownership more than one time, we have a lot of stressors that not all the other industries have. And commingling in itself is a stressor. Transportation is a stressor. And so we will always have a need for the use of antibiotics for the treatment of disease. And I'm really pleased that the industry stepped up in all species groups, and we worked together to remove these medically important antibiotics from the growth promotion status, and we use those now for prevention, control, and treatment. So through this whole process, I think also we've let the conversation get away from us. You talked about the information that's important to consumers and to government, to industry. And they're dictating to us that we use antibiotics by the tons and tons and tons. And certainly when you look at a cattle population, including dairy cows, beef cows, and all phases of production, we have 92 or 93 million head of cattle in the United States. And so whatever we use and multiply it by that number, it is going to add up to some fairly large numbers, but that doesn't necessarily mean that we're using those in an inappropriate manner. But we need to take charge of the conversation and do a better job of explaining how we do it, who we are. You know, over 90% of our beef operations are family owned. And we keep hearing the term factory farms. And when in fact, these are sometimes large family farms, but what is a factory farm? Is that the farm that has more cows than what we have? I was interested in some internet conversations several years ago, and it looked like there are some people who are not very happy with people who own more cows than they do. That makes them a big rancher, and perhaps it's jealousy or something like that. So getting a hold of this conversation and telling our story, because I think there's a good story to tell. You know, just giving a brief background on where our cattle come from, that they move around the country a lot to take advantage of forages and different types of weather and feeding opportunities. But I've been impressed with, for example, the CDC's Get Smart program discusses antibiotics. You know, maybe we need something like that to educate people about where their food comes from, something that's catchy, something that people will pay attention to. I think oftentimes we have a peer-reviewed article or even a non-peer-reviewed article. We want them to read this, and it's 3 pages long, and people don't have the patience to do that. But I think there's several things that we've done in the beef industry that we really haven't touted ourselves on the back, or patted ourselves on the back, such things as working on the E. coli issue many, many years ago, which is a horrible, horrible disease, and putting intervention strategies in and learning whatever we can that we can do at the pre-harvest level and the post-harvest level to reduce the risk of that disease. In addition, in the 90s, there were the injection site lesions that started showing up. And initially we said, well, what are these? You know, is this tumor, injury, whatever it is? And once we define what it is, what's causing that? And the cattlemen put their money where their mouth is, and through using checkoff dollars, they sponsored research to accurately define what was causing these and how these lesions were developed. It all comes back to some simple things like putting injections of animal health products in the muscle rather than administering those subcutaneously. We could ruin as many as 8 steaks with a 40-cent Clostridial vaccine. 8 steaks are worth a lot more money than that. And the way that was handled, it was handled without government intervention, but it was handled through research to define the problem, and then a very intensive educational effort that involved not only the university extension people, but practicing veterinarians, nutritionists, pharmaceutical companies all worked together to resolve that, and we reduced that incidence in top butts from 25% to about 3% in a matter of about 3 or 4 years. And I think things like that are important for people to understand that the industry wants to do a good job. Also, animal welfare. If you look at the way we handle cattle and other species today compared to many, many years ago, there's no comparison. If you think back when, well, very few in here are my age, but when I was a youngster, they did have hot shots, and they still do today. But it was almost a point of pride if you got kicked a few times, got run over, and broke a couple of hot shots working cattle. And today, those are prohibited. We have standards set. These standards were developed by the industry for use by the industry. And today, I can walk into feedlots that I serve, and they can be working cattle all afternoon and never pick up an electric prod. I think those are some things that we should be proud of, how we care for those animals on a day-to-day basis. It reminds me of, I think, one of the most pro-ag presentations that I heard was Paul Harvey a few years ago was was quoted posthumously in a Ram truck ad at about Super Bowl time, if I remember correctly. This is the American farmer on what they do. Up all night checking heifers for calving difficulties. All these things are addressing animal welfare things, and I think things that we should be proud of. We should let the public know what we're doing and why we're doing it, and also look for ways to continually improve what we're doing. You know, the other thing that we sometimes fail to mention is that we are consumers as well as producers. And so I'm asking my grandchildren to eat what your grandchildren eat, or the people down the street that's never been on a farm. And so we want the product to be raised humanely. We want it to be raised in a manner that we reduce stress and look for management systems to reduce the use of antimicrobials the best that we can. There should be an ongoing effort every day to look for ways that I can make that animal's life more pleasant, less stressful, so that there's less chance of that animal being sick and requiring an antibiotic. And then on the antibiotic issue itself, the conversation's gotten away from us in that now we're saying if that animal's ever had an antibiotic in its life, then we don't want that in our store or our restaurant. Is that the right thing to do? I think not. Think about sustainability. If we start, or what do we do with those animals in the first place if we're not going to utilize those in the food chain? But on the sustainability side, just thinking from production agriculture and our goals for sustainability, if an animal is dead before it leaves that feedlot, we have wasted the feed and the water. That's forage feed, that's prepared feed, and the water, all that land that those animals were utilizing for the dam, the cow, all the way through pregnancy, and while the calf was nursing the cow, and then the feed that was grown and hauled in using fuel into that feed yard, and the fuel that's used in those tractors to maintain pens, to check animals, and to deliver feed is all wasted. What's the economic value of that when we're throwing things away because of death loss? So health is extremely important. Judicious use of an antibiotic is an important part of that, but even more importantly, looking for more and better ways to reduce the incidence or to prevent disease is even more important to us and to our survival as an industry. So I'm really impressed by coming to a meeting like this where we can bring together people who have different research expertise and interest. You have regulatory issues that you have to deal with. We have producers here from all the species group. On the beef side, in this room today, we have the people that care for over 25% of the beef cattle that are on feed today in the United States. And we have people here caring for more than 50% of the cattle in Canada, and a significant number of people, a significant number of the cattle that's in Mexico. And I think that's a tribute to these people and to the industry, and also pork and poultry and so forth, that we take time out of our schedule to come in here to learn how to do it better. And I think we need to communicate this all the way up and down the food chain so that people understand that we are committed to reducing the use of antimicrobials, but we're going to use those in a judicious way when they're necessary to address welfare issues.
Bob, thank you so much. Shannon?
Since you all got to hear me yesterday, I'll keep my comments real brief. You know where I come from the preventative side, the management issues. Just want to give you one quick example of the progress that producers can make with the right information. Labor and economics usually drives a producer. Is that correct, Dr. Bob? Labor is a huge issue in our industry, and then obviously economics. So 10 years ago, we had 100 heifers that we were calving out. Just for a disclaimer, I did not pick the genetics on these heifers. We pulled 20 calves. We had 3 C-sections out of that 100 head. This year, we calved out 89 heifers. We pulled 1 calf. Through genetics, through data collection, through that progress, we have EPDs. Back then, we had birth weight EPD, and that was it. You knew the birth weight of that bull, and that was it. Now we have a Cavanese maternal, another Cavanese EPD. We have all this information that we can use and make better decisions. That's a huge economic impact, pulling 20 calves, 3 C-sections down to 1, plus the lack of sleep, and it's a lot better on your marriage when you don't have to get up at 2 in the morning to pull a calf. So those are the types of information that, as producers, if we can gather that nutrition, that health, all of that, that's what drives us. And I think we can do it. It's just a matter of collecting the data.
Thank you very much. So you're a pretty sophisticated group right here. Dawn mentioned that there is no perfect data. Mike said he has to corral a lot of information for folks. Lori very helpfully told us about the data and statistics. Peter mentioned the issue of purpose and context. Bob indicated that producers are also consumers, and that there's 700,000 people that have at least one head of cattle. And Shannon, you also mentioned the importance of data for the work that you do. But you're a sophisticated and diverse group, but as Lori was starting to describe statistics, we know that statisticians and epidemiologists can disagree on the interpretation of data. That's some of the comments that Peter made. How do you interpret these facts, these statistics? And it's not just consumers. We'll talk about consumers later this afternoon, but whether it's 700,000 people that own a head of cattle or from one end of the production chain down to retail, how can you give people a little bit more confidence in information? How can they parse this, what is sometimes too much information? What would you recommend to them, or what do you do in your area to help give people that you work with or that you communicate with more confidence in this amount of information? Anybody want to try and tackle that?
Well, I'll start with dairy.
Please.
We're very fortunate. We're very fortunate in dairy through National Milk Producers Federation and the cooperatives that are represented, and also through help with Dairy Checkoff to have what we call our farm program, which is farmers. Wrong now, Farmers for Responsible Management. But how that's been helpful to us is that it gives us a tool. We require all of our milk to come from dairies that are members of farm. We require all of our domestic ingredients to come from farms, that originally come from farms that participate. And it's basically a management audit. Animal care, are your workers trained in animal care? A lot of it started from some of the animal activist videos that were filmed, where we had some big black eyes. Kroger is lucky we had none that directly affected any of the dairies that shipped to us, but certainly a lot of our friends did, and certainly a lot of our other vendors have had challenges. So what do we do to build a system that builds some consumer confidence? That the animals, first of all, are treated fairly. And that's really where it started, but it's growing beyond that. We're now going into sustainability. Now, sustainability to me is kind of like the emperor's new clothes. What is it? And let's talk honestly. Let's talk about organic milk. There's more carbon under organic milk than any other milk because it tends to move farther to get to the consumer. You have less production per cow, which means your body, your maintenance needs versus productivity are higher. So it isn't necessarily, if you want classic sustainability, it isn't necessarily sustainable. Same with some of our production aids that we see that have hit some significant black eyes. So again, we have a consumer interest. They like organic because there's a set of federal rules that we know people follow, but sometimes the rest of the story isn't known. But from our standpoint, those are the kind of tools, and we see farm going into sustainability, basically. What is the carbon impact? We're seeing it going now into antibiotic use and how we work with veterinaries to have treatment plans on dairies. Those are all very, very positive things that we can send as a message. And we also know, as we talk with producers, that they're helping them be more judicious use. One of my favorite examples is actually a dairyman in Oregon who years ago got very serious. He's a personal friend of mine. I'm from the Jersey cow side of the business originally, and so he's a Jersey producer, big producer in Oregon. And some of the things he was doing just on animal care and on animal comfort, and what that did to his use of antibiotics, what that did to his need for, basically his call rates went down. And he says these are really very simple practices that, programs like Farm help encourage producers to adopt. So they basically have systems that basically have SOPs for dealing with a lot of these issues. We find that's helpful. We find it's a very positive message for consumers. They like it. And we look forward to more of those kind of opportunities across animal agriculture because we think that's the kind of thing, particularly as we're all struggling to figure out exactly how we best deal, for example, with antibiotic resistance, because there is no simple cookbook. So what are the management practices? Kind of what our veterinarian friends have said down here. What are those animal practices that can help limit that use? We're never going to likely totally eliminate use of antibiotics. Again, is that even practical? But just to minimize the need. And a lot of that's just, frankly, modern animal care practices. And back to the point on large farms, my favorite comment on a lot of times when I hear that, because it's this classic, red barn with a silo and 40 cows and stalls, is that how do those dairies that are family farms get to 1,000, 2,000 cows? Because they did such a good job managing their herds. And a lot of times helping people understand that any business that grows did it because they were successful. And it isn't necessarily, they didn't abuse a cow to get there. They got there because they took very good care of their farm and their livestock. And that's not always easy. The web has made it harder, frankly, but it's something that I think we try hard for conventional agriculture to do that. At the same time, I'll admit we're big organic merchants because there is a demand for those products, and we have a consumer base. We want to fill their needs. But I think a lot of it's just good education and having programs that have some formality to it so that we can show what people are doing. And in the case if we do have an incident, we can show, well, there's a process to correct if there's farm problems. There's basically a system that they can enroll in and do that. And as a result, farm is over 98% of all milk in the U.S. now. And it really was driven by the retail business. And eventually, with strong support from the producer trade associations, we've been able to build a program that's helped us. And I think there's opportunity for that kind of a relationship with a lot of this business as well.
Anybody else want to comment before we turn it over to the audience?
So for CDC, clearly we have a lot of data, and I think interpreting it and spending a lot of time very carefully looking at what the data mean for why did we collect it, what are we trying to get out of it, not over-interpreting and reading more into it, just trying to relay the message of what the data actually say and no more than that. We vet within internally at CDC before anything goes out. We share with our partners for review and for vetting, and then when we do publish, it's always peer-reviewed journals. So I think probably the biggest thing, what I realize is that the more partners and collaborations that you share that information with as you're trying to relay it and present it, because it's great feedback before it goes out everywhere. People read and see things from different angles. And so vetting that first before it goes out officially has been very helpful for us to tailor it and make tweaks to make sure we're being as clear as we possibly can. So.
Anybody else on the panel want to comment?
Yeah, I just wanted to return to this issue of reporting successes, because we read and we hear all the time of gloom and doom and how things are getting worse, and others have referred to this. But the two examples that I like to use are one in violative residues in hogs in the United States in 1978 were about 1 in every 7 pigs going to market. So you're looking at something of tens of millions of cattle pigs, going into the food chain with violative residues. So there was a time for really justified outrage, but at that time the society wasn't in tune with that. Now, nationally, I think we're running around about 0.2% of our food animals with violated residues. You can say that's 2 in 1,000, it's still too many, but in relation to where we were, it is phenomenal progress, and I think we don't seem to do a very good job at communicating that progress. Another one, and I think you heard the comment made today from the FDA on the retail meat sampling, saying we're increasing our sample size, but we're getting less isolates out of the retail food samples. So we have very well documented reductions in salmonella in most of the food animal species through the FSIS monitoring, and that further furthermore, we've had a reduction in about half of the proportion of human salmonella infections that are multiple drug resistance over the last 20 years. So there is quite a number of issues where we can say, look, these changes, some regulatory based, some otherwise, actually have got demonstrated improvements in issues that consumers could care about, but I think we've just, the industries collectively have done a bad job of communicating it, and also there's the issue that a lot of the audience maybe not be equally receptive to that sort of message.
You know, Peter, back in the early 80s, the violative residue rate, chemical residues in beef, was about 1.6 or 1.8%. And that was considered the standard. The late Lad Hitch of Hitch Enterprises in Guyman, Oklahoma, told his newly hired young veterinarian, D. Griffin, that if it ain't right, let's fix it. And they opened lines of communication and fixed that within a short period of time. Today, I don't know that we understand that there's a difference in antibiotic-free and a minimum residue level. The government has determined that there are safe levels, and we work to keep our residue levels less than that standard. And I think we've done a pretty good job, like the number that you quoted for swine in that one. But that's another example of progress that the industry has made. But you know, when we're talking about people's acceptance of animal protein, a lot of the work will have to be done at the local level, because it's harder for the National Cattlemen's Beef Association or Pork Producers Council to make contact with those people. But these programs where people are involved with the local civic organizations, they are the bloggers, which gives us a national audience. There's a lady that lives up the road from us a few miles called the Prairie Woman, I think it is, Reed Drummond. I think she's been really good for the beef industry because she married into a ranching family. But also not all industries can have guests in or visitors in because of biosecurity concerns, but when we can, bringing in people who are influencers in their community for tours and show them what we're doing, I think has positive effects. You know, think about when you're on an airplane and someone asks you a question about this technology or that technology or this risk or that risk, how many people seem to be reassured that the food supply is safer than what they thought it was after that conversation? So we have to reach out in that way and I think touch people, a lot of these in very small group situations.
Anybody else want to comment before we open it up? Any questions from the audience?
So thank you. Fascinating discussion. I was, I recognize, you guys come from all different industries and, they have differences, right? But I like the analogy of the hourglass that was given by Angie from Cargill yesterday. So don't you think we need to kind of get together and find the data that is common and then find a way that we can communicate one message to the consumer about what we're doing and what agriculture is doing? So have a unified message despite the differences that we have between industries. And maybe data collection and proper data collection will help to do that.
Is that possible?
I'll just make a comment. At a recent conference we held at the University of Minnesota, we had a woman who's with a business area talking about the concept of cooperation, where sectors of an industry that are normally competitors work together on areas where there's common interest, and the collective benefit of working together is considered more important than their normal competitive situations. And I think this is an issue that is like that. I think what we see going on, the market forces are very strong, and they're already launched. The magnitude of the antibiotic-free production in the poultry industry and in other industries growingly. I think the example we saw with Joel Neeram from Pipestone about individual systems that are moving forward to get better at what they're doing and be able to communicate to their customers that they're doing things well in the supply chain. Those forces are going to continue. I think the work that I'm trying to do across the broader industry at the moment is really more to where you are. We're saying, okay, those initiatives aren't going to go away, and many companies have data, looking at data and looking to get better. How do we harness that really to be able to get more representative data, to get a better understanding of where the industry's at and where it could go? It's, I think, a challenge within an individual industry, and I'm sure it's a way more difficult challenge to be try and harmonise that and unify it across industry. So I don't know the answer to that. But I think the conversation we're having is taking us to that area. So where I'm uncertain about is, are we, at first, do individual industries need to do the best job that they can for their own industry to make themselves better at what they're doing and communicate it? Because I think there's a natural tension between wanting to harmonise things across disparate environments versus trying to customise them to do the best job in your own house.
Something I'd like to add, that just speaking from the beef industry, when we get the whole supply chain together in one room and portraying that united front, that's huge, because we no longer have that competition within ourselves. We're all working towards, and I think that portrays a good story to the consumer, that we're not competing. And then take that one step further, and you have the competition between the pork and the chicken and the beef. Well, if we provide a united front that we're all producing protein, and we need to continue to produce quality, safe protein for the consumer, that has a bigger impact too.
Yeah, I mean, from a consumer standpoint, I agree completely. It's very difficult to get a set of data that covers all proteins. I mean, it's unlikely to happen. But I agree that from a consumer standpoint, and we're talking about economics, and the economics depend on what the consumer is willing to purchase and how much the consumer is willing to pay for that. So yes, if we can, each individual species do the best they can, figure out what the context of their data is, then, and I agree, it should be a non-competitive issue. I mean, we're all consumers, we're all producers. I mean, this should be the quintessential non-competitive issue. And if we can for our individual species, develop context for the data, develop good information, and, report out results and progress toward whatever success looks like, then we should be able to aggregate among the proteins a message to the consumer that says we all understand this and we are all working to be better stewards of our antibiotics.
Any other comments on the Hourglass? Other questions from the audience?
So Steve, this session is actually focusing on data. And one of the things that I thought was kind of surprising or interesting today is that, we heard about the Pipestone system, which was very intriguing in the model they have. And I'm familiar with what Peter's doing, and then also what Randy's doing, and then also realizing that there's other disparate groups of collecting data. So I wonder if the panel could actually address the fact that there are disparate groups pulling together data, and actually USDA is pulling together data, and there are general biases in their reflective groups. So how can they come together with that data, maintain the confidentiality, the proprietariness of that data, but yet pull it together to make it more robust?
That's a nice challenging question. Who'd like to start? It's quite challenging.
I came all the way, I might as well talk. Yeah. I think, Jeff, as Dawn said, earlier on. There's a lot of data, there's no perfect set of data. And I think Larry Granger said before about the importance of metadata and context and understand where things are going at. So I think in the initiative I'm involved in, and Pipestone and others, I think it's really important that there's a detail recorded of process and how things are done, and also an effort to understand the biases that are inherent in the data. Because I know in our own project it's very biased towards the larger end of the industry, because they're the people who have organised data and are more willing to serve it. So we cannot claim that this is going to be representative data. It may be representative for a reasonable portion of the industry that's out there, but there'll be gaps that are there. So I think those two things in terms of understanding and communicating the limitations of data that come from disparate but complementary sources is a really important part of being able to stitch together more meaningful information. But I think at the end, going back to what I said earlier, each initiative really needs to be very clear about their purpose and designing what they're doing to meet that purpose. And then I think and we can't expect uniformity in that situation, even among commercial entities, I think. So I think the idea of being open to sharing and being in a position to communicate how you've done things and your perceived limitations to things is in the sort of collective interest, but it's not easy either.
Dawn, I don't want to put you on the spot, but I know that you have experience with this both on the human side and on the animal side. You've seen it from the state level, you've seen it from the federal level, aggregating different data sources. I mean, it's very challenging. I mean, do you have a perspective on that?
So you're right, it's extremely challenging, and with the information that's been presented here, again, having both sides, I do sometimes relate it back to how was it done on healthcare, how were we able to move that forward, and then how can we translate? It's very different, but I think there's a lot of information out there. My first inclination is to say let's be better at sharing what is being done and collected out there so that we're aware of what people are doing and the data people are willing to share and have found that they can collect and share, because I think that's a first start. I can relay back to the National Healthcare Safety Network with all of the hospitals and healthcare settings in the nation. That was a huge deal to bring that into play and to have all hospitals and all healthcare settings report into it. I think there is a way with willingness to be able to figure out a level of data that can feed back and be meaningful to its users and still be confidential. So for NHSN, all of the hospitals put their data in and it's confidential to them, but yet there are aggregate data, or you can invite somebody into the system and say, we will share these data. So 7 hospitals in a healthcare system, corporate can look at the data if they so choose. If there were a bunch of farms in a corporation, they could put data in a corporation. So there are different ways to be able to create systems where you can aggregate data where it remains confidential at one level and then is aggregated up at an agreeable level to be useful. I think Dr. Hicks talked about benchmarking and deciding what an important benchmark is and using those data for that. It doesn't, and a benchmark isn't an end-all, be-all. When she was talking about that, and then when others made comments about species being different, I think I sort of relayed species and the differences between drug use to say if you have that level of specificity and stratification, you can bring it down and pull out and just look at swine or just look at poultry and just look at a specific drug if you were talking about use. So you're not comparing 2 drugs that have different doses and different lengths of time. But I think that there's ways if we really put our heads together and we could start looking at data and say what would be a system that could work and give people what they need. But again, I think it starts with what is everyone capable of collecting and what are we going to use it for? How would we need it and use it? And then I think you could move forward from there.
Any other comments in response to Jeff's question?
I do have a follow-up on the Hourglass. The mine doesn't work as well as it used to. And it's the U.S. Farmers and Ranchers Alliance. And that's 100 different organizations that have come together to work on the issue as you described. So I found it on the web while the response to the other question was being done. U.S. Farmers and Ranchers Alliance.
Anything else from the audience? So we have just about 5 minutes left. So let me just ask you just one last question then. There's a lot of discussion yesterday and today about what data. I mean, we've heard a lot about the data needs. You've spoken about it. We've heard it from some of the other speakers. Let me ask each of you, if you don't mind commenting, what do you think are one or two barriers that exist to getting us any of the data that you've spoken about needing or that you've heard needed? Are there some barriers that can be overcome that you think we could tackle, let's say, before we meet again next year? What's standing in the way of getting some of the data that you're interested in getting or that you've heard others are interested in getting?
I had lunch some time back with a representative from a large retail firm, and to quote this person, they said, paraphrasing, I guess, our company is a very strong believer in science, and that's the way we like to make decisions. The social media is just beating us up, and so we're doing some things that we know is not scientifically based. So I think it comes back to increasing our efforts to get our message out so that they hear what's being done, not only by producers, but by researchers, by government agencies, researchers at the federal level, our state departments of health, and then on down the line.
Barriers?
I think one barrier from, again, where I'm positioned and trying to encourage voluntary sharing of antibiotic use data by people in the industry is that this issue is so radioactive that people's first instinct isn't just to jump in and I'll give you everything I've got. Things take a long time. They end up going to legal and other places because there's an obvious sense of vulnerability in basically opening your books and participating. So I think that is a very understandable barrier that is partly being created by the problem we're addressing in terms of the social media, the profile of the issue. So people are a little gun shy, and I certainly would be myself.
I think another one would be just the proprietary part of it. You know, if I found something that is working and it's going to give me a little bit competitive advantage, I don't want to share that. So how do we get over that?
Lori, did you have a comment?
Well, I think that's exactly it. It's if I provide this data, is it going to turn up on social media? Am I going to get blasted for it on social media? So, I mean, I think to your point, we need to figure out what data we can obtain, what data we need, and then develop the trust to make people understand how that data is going to be used, that it will be kept confidential, and that disclosure isn't going to come back around and create a huge problem for the producer. We need to figure out that confidentiality and proprietary piece and build that trust in the people who are going to give us that information.
Yep. So I think beyond the confidentiality, there's a couple things worth mentioning, and they came up last week as well at the NARMS public meeting, and that's the lab results and the diagnostics for the animal side, animal specimens, and being able to trust those data. I know USDA and FDA are doing a tremendous amount of work in that right now, making sure with accreditation and proficiency testing, making sure and working towards those results with the animal specimens and breakpoints and things like that. And then also with ease and collection of data, the conversation about electronic data transfer, and we sort of aren't there yet, but I know from the hospital side that's a huge ordeal, that there's this burden of having to collect data and put it in and share it so that everybody's reporting and saying the same thing. So what is that standard platform of data so that we're all saying the same thing with each variable or with each piece of data that are being reported, so that you can compare and it's meaningful and it all can come together with ease. And so I think there's that whole level of electronic reporting.
I've had a lot of experience with farm financial data in collection and aggregation of farm data, and it's the same thing. I mean, in my current job, when we're doing strategic planning, working with our vendors and our suppliers, non-disclosures and how important they are. But the bigger thing is, I've had my data stolen from 3 different health companies, from 4 different department stores. There's just a general distrust of how this data is protected, that I think particularly you work with producers or work with any group of people, there's concern on sharing because of the theft that we see. I mean, I'll be perfectly honest with you. We talk about all the HIPAA and its health claims, but based on how often my data has been stolen, everybody already knows that I'm a type 2 diabetic without knowing I'm fat and 58. I mean, we all are. But the point is that, yeah, I think security of information and trust, even if we have these agreements for non-disclosure, that it truly can be secured, is a big concern. I think not just in agriculture, but everywhere.
Thank you very, very much. I'm making eye contact with Neville. We are right on the dot of time. We gave you a very, very difficult assignment, panel, and I think you did a great job. Thank you so much.